Hello everyone, good morning. How are you guys doing? Welcome back to my YouTube video channel. I have a few minutes today and just try to present to you a case where there is a cervical decay on number 5, 6, 7. The angle that the assistant is recording is not very good angle. If you look from above down, you will see a very severe indication of calcification, decalcification, and incipient decay at the cervical of those three front teeth of the patient. Two front teeth and one posterior, number 5 and number 6 and 7. So this is the reason why we have to try to do a restoration to repair the damage of the enamel. The angle here looks pretty insignificant in order to drill the tooth. But if you look at the cervical from the angle where I am from the top down, you would see a quite significant irritation of the area with cavity, incipient cavity, and really large cervical area of decalcification process. That it looks like patient is starting to have more rampant decay if we don't prevent filling. So anyway, I'm doing the filling. With this particular filling, sometimes it's very hard to get a good isolation area. So I use the rubber dam type of isolation retract on the lip. That's helped me to see better vision. It looks clean, so I would suggest everyone who haven't had this chance, buy this one. It's nice to have this one to use it. You can search online, you should see it. And then the packing the core around the cervical also help to isolate the margin from the composite material, the bonding material, the etching material that you're going to use. So give you a lot more vision. So, you can see at the retract, you can see more of the incipient enamel decalcification and then also incipient decay as well. So yep, the patient complaint sensitivity, and that's what I see. So we rinse, after we prep the area, we adjust the enamel, rough the area enamel. We now etch the area and rinse it. So you can see that there's still some arrest dentin decay. I wouldn't really remove them. The more you remove, the more sensitivity the patient will have. So as long as there's a sound, strong enamel, you can leave it there and rinse really well. And my goal is to prevent these enamel become more vulnerable for sugary stuff. And so we're going to go ahead and bond the tooth right now, bond with prime and bond material, and let it dry. You were supposed to, ideally you still have to go ahead and put the clear matrix band into approximately that would prevent you from having the problem with stuck with the two teeth together when you finish the filling. In this case, I didn't have a chance to record that part, but right now we are putting prime and bond, and now we start running flowable composite. After flowable composites, a little bit of the time, cure it and finish it. This is the composite of 3M, which is very good material from 3M. I love it. That's strong. Work very well when those small restoration need to be done. A2 color, very common color. Slowly take your time, remove accessory material, and also spread the material evenly. It's just like a cement, when you do a concrete cement, take your time, level it out, and yep, make sure that those are a little detail that you need to do. Guide the assistant for the right location for the penetration of UV light. It's important. Sometimes you rely too much on the dental assistant, you miss out the angle where it's supposed to shoot, and you realize why the filling came out. Sometimes the filling came out because the assistant, it's not the dentist, hit the wrong UV light angle, doesn't really improve anything in terms of the curing the materials, making sure that it is strong bonding. Notice that there is a matrix band that shouldn't be used in this clear. This matrix band metal one. However, I got what I need. The system is repairing. I was in the situation where I gotta keep moving. I use this at the line angle. I secure it and still able to smooth everything out nice and smooth. Diamond bird, long shank diamond bird, smooth it out nicely, and take time. This process takes time. It does require a lot of dedication to the procedure that you do. You do need to have enough time to do this. Can't be hurried because tiny little catch of a composite can cause gum irritation and lead to possibility of recurrent decay. So even though it's simple, it does take a lot of time, guys. A lot of instrument usage, a lot of material need to be used. So yeah, now I'm just wrap it up and hope you guys enjoy the video and see you next time. Have a good day. Bye bye.